10 action steps to take before and after a car accident. In this video, I'll review 10 things you can do to minimize risk and injury and maximize recovery. 5 things you can do before you ever get into a car collision, and 5 to do as soon as possible after a collision to give you the best outcomes in regards to your health, finances, and overall future. I'm Dr. Kevin Leach, NUCCA chiropractor. One of my main focuses in practice is managing patients that have been in car crashes. Now, even if you don't come to me to manage your care after a car collision, the following information can be invaluable to you if you choose to utilize it. Number 1, get good auto insurance with a good company, including personal injury protection, or what's known as PIP coverage. Don't just get the cheapest. There are good companies, there are okay companies, and there are really bad companies. So definitely do your research before purchasing a policy. Once you decide your company, choose a local reputable agent you can meet with and set up your policy. They can guide you to make the decisions that will best fit you. My personal insurance agent sat down with me and explained all parts of my policy so that everything was clear and I understood what was covered and how much would be covered. Okay, number 2, don't get the minimum $10,000. This might be enough for a minor injury. However, it will not nearly be enough if you are transported to the hospital and or you need imaging and expensive exams done. This will leave very little for the care you'll need to recover with treatment. To get the $25,000 coverage is such a small amount more per month, it makes it's absolutely worth it in the end to do it. Number 3, find a good chiropractor who practices as a primary spine care provider. A primary spine care provider is a doctor who not only gives conservative care for your injuries, but also will examine you and determine if you need specialized tests or referrals to other providers. He or she can manage your case and make sure you get the help you need for the best possible recovery back to health. Number 4, we're going to go into the car for the 2 parts of number 4. Okay, this one has 2 different things we want to set up for your car. The first thing is we want to set up how you're positioned to make sure that if you get into an accident, if you get into a crash, you're going to have the least amount of injury and the least amount of possibility for death as well. And the second is what to do when you know a crash is about to happen. So just a couple things the way you want to set up your seat. The back headrest here should be at least at the top of your head or a little bit higher. And the reason why is because when a lot of people, when you get into a car accident, you're going to ramp up. And so if it's too low, your head's going to go back over the back headrest. So you want to make sure it's high enough. And when you're set up, you want to make sure that your head is actually really close to that as well, so that when you hit it, you're not coming from way forward and coming far back. Another thing you want to look at is your distance between the dashboard and your knee. It should be at least 4 inches, if not more. And that's because if your knees go forward during the crash, your knees aren't really close to get injured immediately that way. So this is about a good position to be driving in for optimal safety. Now, the second thing is, if you're looking in the mirror, or if you're looking ahead of you, or something is happening where you know you're about to get into a crash, this is what you want to do. So the first thing you do is you want to slam on the brakes as hard as you can. And so what that's going to do is that's going to create the least amount of movement for the car. Because what happens is if you don't have the brakes on and the car hits you, then you're going to move more. If your car is stationary and sturdy and you get hit, you're not going to be whipped as hard and you're going to have less of an injury. So slamming down on the foot on the brake, what you're going to do is you're going to put your hands out on the steering wheel, and you're also going to tuck your chin back and put your head against the back headrest here. So this is the position here, and you want your head straight, because if your head's turned, you have an increase of injury as well. So if you know someone's going to hit you, if you're in front of you, you want to slam and put your hands out, chin tucked, head back against the headrest just like this. Okay? Now, I didn't mention it in the video when I was in the car, but what you want to do is you want to create a muscle memory with doing the protection stance that I showed you in the car. Try to think about the potential of being in an accident and just do it. Do it 20 times, 30 times, 40 times. Just prepare yourself to know that if something happens, you know, boom, you just know exactly how to get right into that position. It's really important. Number 5, become an expert and overly aware driver to prevent collisions. When I'm driving, I pride myself on being so aware of everyone and everything that is happening on the road that my chances of getting into a collision are extremely low. I've seen what car crash injuries do to people, and I do not want to get into one. It only takes a split second, and 50% of people in car accidents have chronic pain. The best way to take care of your spine is to never injure it in the first place. Okay, moving on to what to do after you've had a car collision. Number 1, if you get in a car crash and if you aren't immediately taken to the hospital, assess your body and any potential injuries you or others might have. If you have the slightest feeling in your gut, you should go to the hospital. Please do so. If you don't feel absolutely certain and comfortable driving there yourself, get someone to take you. It's better to be safe than sorry. Number 2, after you're cleared at the hospital or urgent care, or you didn't go but still have discomfort or pain, immediately or even days after your crash, seeing someone who specializes in the diagnosis and management of conditions related to the spine is essential to get you to the exact care you need. Do it as soon as you possibly can. The longer injuries go undetected and untreated, the worse the outcomes will be. Number 3, consult a personal injury, aka PIP lawyer. And don't be overly concerned about the cost. Most initial consultations are complimentary. Use all means necessary to get well and do it ASAP. Do not sign any papers or cash any checks from your insurance or the other's insurance until you talk to a lawyer, no matter how friendly they are or how much they seem to want to help. Number 4, educate yourself on the insurance game. They are a business and they want to make money. They do not have your best interest in mind regardless of how nice your agent may seem. Your agents want you well, but they are taught to deny as many claims as they can and to cut off your care as soon as they can. Ask your doctor and lawyer anything that is unclear about the process. Number 5, don't do anything without consulting your doctor or attorney, especially when dealing with your insurance company or the other party's insurance company. Follow doctor's recommendations and document everything related to the collision. If you're asked to do something called an IME or an insurance medical evaluation, tell your doctor and lawyer immediately. It's a sign they want to stop paying for your care. Okay, those are the 10 must-dos before and after a collision. If you have any questions, head to my website or YouTube channel and let me know. If you're seeking care for a car crash, call the office ASAP and get the care you need. I hope this was helpful and stay safe out there on the road.